Good morning, everyone. I'm Elisabetta Chessa, and I'm going to present you the results of our systematic literature review regarding the psychometric properties of patient global assessment in psoriatic arthritis. Patient global assessment is a patient-reported outcome that reflects patient's judgment on their disease activity and global health status in psoriatic arthritis, and the aim of our review was to assess psychometric properties of patient global assessment in psoriatic arthritis. To do so, we research articles reporting data on the psychometric properties of PTGA in psoriatic arthritis listed in PubMed, and they were extracted according to the Cosmin terminology and the Homer Act filter 2.1. Validity was assessed for the comprehensiveness of the instrument, the contact validity, the correlations with other disease activity instruments, the construct validity, of which we perform also a meta-analysis, the correlation with the quality of life measurements, the criterion validity, and also we assessed discrimination, which is to say the responsiveness of the instruments. The external responsiveness was assessed as the correlations between PTGA variations and other indices variations, while the internal responsiveness as the correlations between PTGA variations and after treatment. We also collected data on the formulation of PTGA and regarding the discordance between patient global assessment and physician global assessment. Of 60 articles analyzed, comprising more than 70,000 patients, 44 were observational studies and 16 were trials. PTGA was assessed through 27 different formulations. In all the retrieved studies, PTGA assessed disease activity, and in 3 studies, PTGA was assessed as a variable of global health status. The correlations between PTGA and other patient-reported outcomes was strong, whereas with other disease activity indices and physician global assessment, it ranged from weak to moderate. Responsiveness was assessed in 24 studies, showed a strong correlations with joint count index variations, while 3 studies described a positive discordance, which means physician global assessment lower than patient global assessment. In conclusion, PTGA is a valid and responsive tool in PSA. Correlations were higher with PROS and weaker with other disease activity indices and physician global assessment. Physician global assessment was usually scored lower than PTGA, and a standardized formulation of PTGA would be useful. Thank you for your attention.